Good morning, everyone. It is December 17th, 2024. I'm going to call the December Board of Health meeting to order. My name is Deanna at 8:01 a.m. My name is Deanna Diamore, Director of Health for the City of Norwalk. Present today, we have Board of Health members Frank Ehrlich, Norman Weinberger, Joan McNeil, Anthony Santella, and Ken Lalim. We also have our Chief of Community Services, Lamont Daniels, and we have Health Department staff members, Bill Mooney, Teresa Argandesi, Daniela Fignon, and Brian Weeks. Did I miss anybody? I think I got everybody. Okay.
Hey, Ken, we could see you for a minute.
Yeah.
Yeah, I'm really questioning whether it's bleeping out on me. Doesn't want me to be here.
Well, we want you to be here, Ken, so stick around. Okay. The first item on the, actually, we'll call to order. We did a roll call. Public participation is next. I don't see anybody attending in the Zoom. Aniela, can you just confirm that for me?
Correct.
So you also see the same? Okay. All right. Next item on the agenda, thank you, Aniela, is acceptance of the minutes. As you know, we had our regular meeting in November, and then we also had our special meeting on December 10th. So is there a motion to accept the regular meeting minutes of November 26, 2024?
So moved.
Okay,
I'll
Frank
second.
and then Joan seconds. Okay, any discussion on those minutes? Any edits?
No.
All right, hearing no discussion. All those in favor say aye.
Aye.
Any opposed? Any abstention?
I'll abstain, right, because I wasn't here again.
Okay, thanks, Anthony. Okay, so the minutes passed. Thank you. The next minutes to review are from the special meeting December 10th. So do I have a motion to approve the minutes from December 10th, 2024?
So moved.
Frank's moved. Do I have a second?
Second.
Ken second. All right. Any discussion on those minutes? All right. Hearing none. All those in favor say aye.
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 Any opposed? Any abstentions? All right, the minutes passed. Thank you. All right, we're going to jump next into our epidemiology updates. So good morning, Brian. He is our program director of epidemiology and informatics.
Hey, good morning, Deanna. Good morning, everybody. So this will be just a quick overview. It's just a check-in in the aftermath of Thanksgiving and then heading into the remaining holidays in December, and then also the new year. So let me just change my screen share. We can kind of just briefly go over it. All right, so as you are seeing, this is the CDC Respiratory Illnesses data channel. So they've updated it once more. So they color coded it a little bit better too. So this is what you're seeing here in terms of minimal, low, moderate, high, and very high. And then generally speaking, you know, there's the quick snapshot. So this is looking at it for the nation right now. So for the United States, overall respiratory illness activity is at moderate or the orange level now. Wastewater virus activity levels for COVID, flu, and RSV are low nationally speaking. And then emergency department visits to the United States are low for COVID and flu, but increasing. And then RSV is at moderate and increasing. And then when we zoom into Connecticut, you're going to see this trend with RSV getting very high in terms of wastewater activity. Overall respiratory illness activity in Connecticut is still moderate, so kind of mirroring the national trends, but you can see how COVID-19 is at moderate, flu is at low, RSV again, very high. Emergency department visits, you know, is low with no change for COVID. Flu is low but increasing, and then RSV again moderate and increasing relative to emergency department visits, so leading to more severe health outcomes. So just want to emphasize that point. And then looking at the data itself, you know, this is just jumping straight into like the forecasting from the CDC. So this is using emergency department visit data, and then they're showing it by state. So I showed this in the past, but you know, again, it's just emphasizing the point. You know, again, we're in that uptick phase in the aftermath of Thanksgiving and just approaching more holidays that are going to contribute to that even more so. So this is COVID-19 and showing, again, a likely growing, or if not full-on growing forecast model for pretty much all the East Coast as well as the South and the Midwest, you know, for COVID-19. And then for flu, because they only have those two, you can see flu is very deep purple everywhere, pretty much nationwide. where they apply that forecasting model. And so again, that's West Coast, East Coast, Midwest, South, everything. So, and you should anticipate it's similar for RSV right now, just because, things are just really picking up. And that's further supported via, so this is the National Respiratory and Enteric Virus Surveillance System from the CDC. So it's just another kind of national surveillance dashboard, which is really helpful to kind of piece this all together. And it's looking at a broader range of respiratory viruses. And so you can kind of see here for the nation, the weekly percent of tests positive for respiratory viruses reported to the system. It's actually decreasing slightly, but the primary driver for, besides the big three, is rhinovirus, which is like kind of the standard cold, as well as enterovirus. And the big concern also with enterovirus too is sometimes it can, very rarely, manifest in young kids as the acute flaccid myelitis, the AFM. So it's something just important to kind of keep in mind. That means paralysis, sometimes. So it does affect the nervous system in some cases. And so it's something just important to be mindful of. That's kind of nationally speaking what's really kind of, distributed amongst the population besides the big three, and then you can see also they show RSV here in the green. So it's a little bit further down in terms of those weekly percent positive tests, but it's definitely standing out from some of the other respiratory viruses. Then along with that, looking at this dashboard, I just want to also emphasize the norovirus weekly tests and percent positives are also on the incline. And so just want to emphasize being mindful of norovirus. Again, that's an enteric disease. So it's something that's, fecal oral, but, again, that could be, a food worker that is, presenting with the illness, or a common touch surface. Somebody touches and then they eat something, or they don't wash their hands. Keeping in mind that hand sanitizer is not effective against it. And so that's another important thing. But I just want to emphasize from a national perspective, norovirus is on the rise. And naturally, 'tis the season with the colder weather, but I just wanted to kind of remind everybody about that too, to be careful, but also washing their hands, especially a lot of these holidays that are incoming are also big festive and food related holidays too. So that is just a quick surveillance data updates to summarize really quick. As we anticipate, in the aftermath of Thanksgiving, all the respiratory viruses are experiencing some level of incline, but especially in Connecticut, RSV is rising quite substantially. Along with that, nationally speaking, we have rhinovirus and enterovirus, still at high levels. And then along with that, we have norovirus on the incline too through the season. So just be mindful of that. Thanks, everybody.
Thank you so much, Brian. Does anybody have any questions or discussion related to Brian's updates?
Nope.
Great job as always. Thanks, Brian. Okay, the next item on the agenda is the vape shop ordinance. So you might have seen in the news, there were some articles covering how the ordinance committee several months ago brought this up as the ordinance committee of the Common Council brought this up as a discussion item, because there's been a history of growth and, of smoke and vape shops, throughout the state, and Norwalk has also seen that growth. But what's been happening at some of these establishments is that they've been selling illegal cannabis and high THC illegal products. And so the police department has really done a phenomenal job of investigating these instances. I believe back in August, our chief of police reported that they had done investigation about 14 investigations, throughout different smoke shops, vape shops in Norwalk. And so, but I believe, the community, and there's concerns about these establishments, about, what more can be done to regulate this, to tackle these issues. And so the ordinance committee has been looking at establishing an ordinance to see if are there additional regulations that can be put in place. And I think at the same time, the zoning commission is also looking at this and seeing, is there something that can be done on the zoning side to enhance their regulations. And so, I received notice that the ordinance committee actually has now drafted an ordinance, and it's going to be up for discussion tonight at their meeting. And so that I sent you all a draft of this. I wanted you to be aware of it, so to give you an update on it. And I want to talk to you all and get your thoughts, because as you've seen in the ordinance, the health department is in the ordinance and has been in this draft ordinance granted powers to permit and to license vape shops, to enforce them, to remove licenses for those that are in violation, doing illegal activity. I believe the thought was similar to the massage establishments, creating up a structure to have health be involved in the enforcement side of things. I do have concerns about this ordinance, and I have, talked a little bit about this, saying, I don't think it's a great fit for the health department to be the ones to enforce this for lots of reasons. Sort of at the baseline is just the concept of the health department giving a license to a vape shop, when we're all about preventing people from using preventing vaping, preventing the use of tobacco products, because they're result in so much premature death in our country and our history. And so the thought of, our prevent, promote, protect logo on a permit or a license for the sale of these products, it seemed to me, looking at it, I understand the intention of it. It's all really good and important. But I don't know if other people are thinking the same way that I would initially think, as the health department, like the perspectives that we bring. And so I want to share that with them. I want to make them aware of it. But I also, at the same time, as a health director, I have those concerns, but I want to know from the Board of Health perspective, what you're thinking about it. There's other concerns too about safety, right? Like, this is all, if this is related to illegal drugs, then, the safety of our staff, thinking through some of that. It just seems, outside of our scope and training, like some of the wording, and as it's written right now in this ordinance, is about like, we would be authorized to go into the establishments and look at these products and, evaluating them and handling them. And so those are just some of mine. And then the last thing I'll say is related to the scope of the health department. Our job descriptions are written, for our sanitarians are authorized to do inspections related to environmental health matters. So it's sort of, specific to environmental health. And so again, this sort of seems outside the scope. So wanted to share that with you. And then I also wanted to open up the floor to, what all your thoughts are, so that I can, I'm sure the ordinance committee is going to be wanting to have that dialogue and understand, what your perspectives are. So going to sort of open the floor up. And if you also questions, right, like thinking about this concept, if you have any questions for Common Council or for, any people that are working on this ordinance, I can certainly pass that along as well.
Yeah.
Frank?
As I was commenting before the meeting started, I think this is a huge mistake, getting the Board of Health involved. One of the things that I didn't mention earlier, but are they going to ask us to approve gun stores? I think there's a whole set of issues that we don't approve of vaping. Therefore, how can we approve a shop that sells vape products if we're opposed to vaping? If we're not opposed to vaping, it's a whole different story. But I believe if we took a vote of the members of this committee, we'd be voting against vaping. So I don't understand how they can even anticipate that it's appropriate to ask us to approve a store that sells vaping products.
Yeah.
Thank you, Frank.
I mean, I
Any
agree
other?
too. I think it's kind of like the opposite of a public health approach. It's saying like, any kind of tobacco vaping products, are drive a lot of, as you said, kind of premature morbidity and mortality. And it's essentially kind of blessing it as long as it's distributed in a venue that meets someone's guidance. So it seems kind of contradictory or maybe even hypocritical to kind of what public health stands for. So I agree with that. The other question I had, or I guess the question I had, if something like this were to happen, just given the conversation you and I had last week about staffing, like, are you really equipped to take something like this on? And what does that mean for the staff that are already, doing their regular jobs?
Right, and I'll say, yeah, and the answer to that is we are not equipped. We do not have the staffing in place, currently.
I agree with the comments that have been made, and I was writing my notes. I said, how would you staff this? Who would be responsible? How would you assure their safety? I don't think this is a job for public health. I think we're a department that faces the issues of prevention. I think somehow the council misconstrued what we do with what they want to have done.
Yeah.
I think they're trying to find the easy way out.
Yeah.
I think that today those issues are handled by the police department.
Yeah.
And I really, they want to be able to say it's very similar to the massage ordinance. Well, the massage ordinance, right or wrong, has been in place for a long time, and people, there's regs on there, there's actual documents that support that, there's licensure that's being created by others. I just think that we're headed down a slippery slope of, what else are we going to be responsible for going forward? I just don't see that that's the expertise that the department really wants to bear.
I also agree with what everyone is saying. My question for you is, there's a lot of cannabis retailers in Norwalk who are licensing, who are doing the license for these establishments.
I believe it's zoning that's licensing them. Yeah.
So that's where it should be. Mm-hmm. Yeah.
Thanks, Joan.
Mm-hmm.
All right, so I'm taking your thoughts and your comments, and these just, I understand like this ordinance is in development and will take several months to keep working on it. Would anybody want to join the meeting tonight? Or a future meeting, I can ask the ordinance committee if a Board of Health member would also be welcome to attend. I don't know if any of you are available.
Sure.
It's tonight at 7 p.m. on Zoom.
I'm not available tonight, but I might be available for a future meeting.
Okay. Okay, great.
I can if you
Thank you.
need someone.
Yeah.
Okay. Thank you. All right, I'll let you all know. I'll ask and see if they think tonight it would be great to have a board member or if it's a future meeting. Okay. Thank you. All right. Any other questions, discussions related to the vape shop ordinance?
And how many shops are you aware of right now? Is there a limited number? 20, 30?
I believe the last I heard there were 22 of them. I'm not sure if that's changed in a couple months, but yeah, about 20.
And who's the dictator of the definition of a vape shop? What we be regulating? What is it? What kind of?
Yeah, I mean, I think the definitions they put in a draft definition for it right now in the ordinance as it stands. But I also know that zoning probably has a definition too, because they do include that. And so I think the definition would fall either like within this ordinance or with zoning. We also could talk, like, there are definitions at the state level related to sellers of like vape products, like the electronic cigarettes and such, because there's also, yeah, we didn't even talk about that, right? State level involvement, because those that are selling it, I believe it's the Department of Consumer Protection where you have to like register. So the state also has its own definitions too.
It just feels like we'd be replicating stuff that we don't have any authority over at the moment.
Yeah. exactly.
Yeah, it would seem that this resides in zoning. They're licensing these people, they should keep up with it.
Mhm.
All right, I will get clarification on some of these things that we've brought up too. If I can bring it back to you. All right. All right, hearing no other questions, discussion, I'll,
One last piece. If
yeah, no,
the common council is willing to get educated as to some of these issues, I think that that is a role that we could play on the health of the population that we're trying to bring forward for the city. I can certainly understand why they believe that the need is there. I think from a public health point of view, we'd love to see a lot of that just go away and not be transferred from one place. I don't want to bounce people around too many times, but I do not think that the expertise lies here, the regulatory side of this. You shouldn't continue to take on regulation out of the health department. That's not the way it's supposed to work.
thank you, Ken. All right. Next item on the agenda is the director's report. So first, this probably should have been first, but welcome, Anthony, to your second official Board of Health meeting, your first regular Board of Health meeting. Really happy to have you join the team. Feel very fortunate to have you. So welcome, and looking forward to many years of you contributing your expertise and knowledge and guidance to our operations and to our policies. Next thing I wanted to talk about was the operating budget. I know I talked about it the last time, but I'm continuing to have discussions with city officials about the need for additional staffing. The big focus has been on, lead poisoning control work related to the changes that have been the increased duties that have been happening over the past few, several years, and the levels will drop again starting January 1. And so, given those changes in state statutes and, and the need for additional resources for the health department, I just really looking at advocating for what's necessary for us to, keep up with these state mandates. So that's what I'll be continuing to advocate for, and I'll keep you posted, as a budget, is in development. And then the last piece I wanted to talk about was Medicaid redesign. As you know, Teresa shared last month, the Connecticut Hospital Association has met with community coalitions around Connecticut to propose a framework for Medicaid redesign to provide funding upstream for upstream community coalition work. The health department has led multiple meetings with Norwalk partners. And Ken, thank you for your participation. To share information about the proposal, serve as a liaison between our local partners and the Hospital Association, and to provide partners with information about the opportunities to support the proposal if they choose. Our understanding is the Department of Social Services is expected to release its Medicaid report by early next year. The Health Department will continue to monitor the proposal and other news related to Medicaid innovations and changes, and we'll share any other relevant news in upcoming meetings. So we'll keep you updated on that as well. That is my quick director's report. Is there anything else before we adjourn today? All right. Hearing none, I just want to wish everybody a happy and healthy holiday season. Thank you for all of your contributions over this past calendar year. I'm looking forward to many more great productive meetings over 2025. Thanks, everybody, and thank you to board members and to the staff.
Thank you.
Happy
Okay, thank
holidays,
you.
everybody.
Happy holidays.
Okay.
Merry Christmas.
Okay. Merry Christmas, everyone.